Hi everyone, Dr. Andi here. It is time for today's Facebook Live. This is one of my favorite days. I absolutely love educating, I love sharing, I love answering all of your questions. So I'm looking forward to doing that. I'm also looking forward to having you join us in about 2 weeks at Keto Academy. I will be talking a little bit more about fasting, intermittent fasting, extended fasting, and the reboot, how that pairs with the ketogenic diet and with exogenous ketones. So I'm absolutely looking forward to that. So hopefully you will all be joining us there. For those of you who are new, I'll give you a little bit of background and information on myself and my practice, and then I'll get started answering your questions. So I'm a naturopathic physician. I have been practicing in Toronto for 10 years now, which seems like a long time every time I say it. I initially started focusing on sports medicine. I was a dancer, personal trainer, Pilates instructor. So sports medicine was my sort of foundation and my background, and then I moved more into metabolic nutrition and more hormonal balance, that being insulin and female and male hormones as well. I also deal with a lot of chronic illness in practice, chronic fatigue, fibromyalgia, Lyme, chronic infections. So that sort of encompasses my practice. There are about 19 people in my clinic in Toronto now, and we all focus and function from a low-carb keto standpoint. The foundation of a lot of our protocols really focuses on keto, exogenous ketones. We see a lot of brain injury, we do a lot of neuro rehab, deal with concussions as well, and so that's a big focus in our practice. So again, I'm looking forward to answering all your questions. I will dive right in and answer as much as I can. I'm an educational specialist with Prove It. I have been here since the very beginning. I started with day one from the very first Prove It and Keto event. So I absolutely love sharing my information. I love sharing knowledge with you, and as I mentioned, the intermittent fasting and extended fasting, the reboot, is what I'm going to be focusing on at Keto Academy, so hopefully you guys will be there to join. For those of you who are new, I will give you a little bit of a breakdown on ketones. I've been getting a few more questions about that recently, about what are ketones exactly, so I'll give you a quick breakdown on that. And then I'll start answering your questions. So essentially, ketones are just the breakdown product of fat metabolism. It's essentially when our body transitions over from using carbs for fuel to fat for fuel. We start to break our fat down and we create these little molecules called ketone bodies. And that's what we get in our Keto OS or Keto Nat. We get pure exogenous, we get pure therapeutic ketones, so we're actually drinking beta hydroxybutyrate. All right, so I see all of your questions coming in. Let's get started. So any keto-friendly recommendations for someone who is lactose intolerant? So I'm wondering if you mean more if you're following a ketogenic diet and you're looking for some fat, how to get your fat in without consuming a lot of dairy. So the way I do keto in practice is it's actually dairy-free. I only allow sort of goat and sheep cheese, so you can absolutely follow a ketogenic diet if you're dairy-free. The ketogenic diet, a lot of people will follow it as sort of bacon and cream all day long. That's not how I have my patients follow a ketogenic diet. Again, it's dairy-free. You can get a lot of those healthy fats from more of the plant-based sources. You can get them from your olive oils, from your avocado. If you can tolerate goat cheese, even though you're lactose intolerant, then that's a really great way to get that fat up. Getting in your MCT oils, that 143, putting that on your salad, just having a teaspoon of that, that's a really great way to get your fat in. But the ketogenic diet is absolutely possible if you're lactose intolerant, so that's not a problem at all. So questions about pregnancy. Are ketones safe during pregnancy? And so you absolutely have to talk to your healthcare provider if you are pregnant wanting to take exogenous ketones. We know that ours are approved in sort of healthy adults, 18 and over. We do know that babies are often in ketosis when they're breastfed, so babies do know how to make use of ketones. Moms who are pregnant will often go, or women who are pregnant often go into ketosis a little bit faster than women who aren't. So our bodies do know how to make that transition, but you absolutely have to speak to your healthcare provider to make sure that that is safe for you. So will chewing gum kick you out of ketosis or break your fast? So it depends on what kind of gum you're chewing and what's in it. If you're drinking gum, if you're taking or chewing gum with sugar in it, yes, absolutely, that's going to break your fast, because the whole point of fasting And the whole point of an intermittent fast is we're trying to lower or decrease our insulin levels. And that the insulin levels, when they're low, is what will allow our body to engage in what we call autophagy. Autophagy is what we're trying to trigger and to stimulate through that fasting process. And again, this is a process that decreases as we age and through illness, things like that. And it's just the process of clearing out dead cells and allowing new cells to regenerate and to be formed. And it's the presence of insulin that will inhibit autophagy. So we want to turn autophagy off. So if you're chewing sugarless gum, no, you should be fine. But if you're chewing gum with sugar in it, what you're doing is when you consume sugar, you're spiking your insulin. So that will absolutely break your fast. Same with, mints and things like that have sugar in them. Yes, that will break your fast. So you do need to refrain from consuming something with sugar in that fasting window. So will Prove It help with weight loss or just help you feel good? Well, it's going to help you with both. So I always like to say the weight loss question is a great question, and I always like to start by saying that the exogenous ketones are not a weight loss supplement. That's not actually what they are, but you'll experience, and I like to refer to it as fat loss as opposed to weight loss. You experience fat loss as a secondary benefit to what the ketones are doing inside your system. So they're decreasing your blood sugar levels, they're improving insulin sensitivity. And insulin is essentially that key that opens a cell. So when we want to get sugar out of the blood, the insulin's got to unlock that door so the glucose can go in. And so when that insulin sensitivity is impaired, that key doesn't work. So the body keeps pushing insulin a little bit higher. Insulin is a fat storage hormone. So as your insulin goes up, we're going to store fat right around the middle. So we absolutely want to improve insulin sensitivity so our body's insulin response is a little bit lower. So again, we'll see an improvement in that insulin sensitivity and then a decrease in those insulin levels. We'll see changes on food cravings, on our appetite. There are studies that show that ketones will impact our hunger and satiety hormones, so leptin and ghrelin. And so as we do that and make changes in our insulin, changes in food cravings, our appetite, then we'll start to see fat loss as a secondary benefit. So you will experience those things like mental clarity, enhanced energy, and you'll also experience that fat loss as a secondary benefit. A lot, quite frequently with women. I see a lot of women with hormonal imbalance, early ovulate, and their cycles can be a little bit heavier. They're estrogen dominant. So what the in animal studies enhanced ovulation with the consumption of beta hydroxybutyrate. So there could be some benefit there. Work with your healthcare provider of a ketogenic diet for those who are going through dialysis. And for them, the studies have shown that when you're when you're having dialysis and you're following a ketogenic diet, the benefits or the outcomes are improved. So there is some benefit there as well. But again, in those conditions, you absolutely have to work with your healthcare provider and somebody who's knowledgeable in the ketogenic diet or just ketones in general. So how can I stay in ketosis? That's a great question. It's a big question overall. So there are daily. This is something I see all the time. I see a lot of, again, people who are chronically ill, and fibromyalgia is sort of an outcome of that as well. And what is really interesting about fibromyalgia is often people are